Today's topic is going to be oral issues, and I'm just going to briefly discuss the many issues that come up for people with Parkinson's regarding oral symptoms. At the end, you can ask any questions, and we'll try and keep it brief enough today. Oral issues, and according to the research, 90% of people with Parkinson's have some oral symptom, be it an issue with communication, an issue with swallow, an issue with off symptom of facial expression or lack of facial expression. Dry mouth is another issue that people with Parkinson's experience, and then excess saliva. So communication is the first one that I said I'd touch on. And up to 50% of people with Parkinson's develop difficulties with communication. So be that a blank expression, poor eye gaze, a stooped posture, and common perceptions are that you're being seen as being difficult. I just came off a call there where some presented to A&E and they were assumed to be drunk, and they weren't treated as quickly as they should have been because they thought that the receptionist believed that they had alcohol on board. And also this Parkinson's mask that some people may be aware of. It's the mask-like expression, but that's when you would be wearing off, or you may have off symptoms. And it's very hard to express your facial happiness or sadness or emotions. So some communication considerations to take into account. Is it an off symptom? Is it that you're due your next medication and that you've worn off? Is it a possible issue with timing of medication or lack of effect of medication? Or is it actually a face mask? So something that we've all had to, I suppose, get to grips with and come to terms with is wearing these face masks. And findings have shown that the use of disposable face masks decreases the speech intelligibility. So we all know that speaking through a face mask, you wonder, are you being heard properly? It's very hard to actually hear some people talking with a face mask because it affects the clarity of speech, it affects the volume of speech, and then you can't really read facial expressions also through a mask. Although some people do smile with their eyes, so that sometimes helps. But it's another thing that we've had to, I suppose, come to terms with and try and overcome for the last few years. So speech and language is an issue that many people with Parkinson's will experience. And the brain does a lot. So the brain has to remember all your vocabulary, it has to organize it and form it into the correct sentences. The brain also controls the muscle positions, so including your larynx, which contains your vocal cords, your teeth, the lips, tongue, mouth, and your respiratory system. So all needed to say the words, so be vocal, and also breathe with your breathing. So if you stream off sentences without taking a breath, which sometimes I do, your brain is the one that's responsible for telling you to actually stop, take a breath, and then continue. And then the brain's also responsible then for obviously sending messages to the muscles to make these movements and receive the messages back from the nerve sensors in the body, and then of those muscles that have moved. And then also it allows us to receive the messages back from our ears telling us that your mouths are talking and this is what you're actually saying and these are the sounds that you're saying. So the brain has a huge role obviously in speech. Some issues that you may come across, and these are all, I suppose, the technical terms, but dysarthria is the difficulty with articulation of sounds or syllables. Apraxia is an acquired oral motor speech disorder, so it affects your ability to translate conscious speech into motor. Aphasia is then the comprehension and communication side of it. So this is reading, speaking, or writing, resulting in damage to the brain or to a specific area of the brain. And there is actually a support group that I came across, Aphasia Ireland, and they do Zooms So it's a good support network for some people to maybe know about. Hypophonia then is your volume, is the volume. So your volume of speech can be affected. You can speak very low and soft and nobody is able to hear you, or you can, well, rarely you shout, but it's an issue with the volume. And monotone then is where you don't, and you're unable to change the pitch of your voice, no intonations, and unable to express properly. So some tips to help overcome and aid speech issues. So make sure you choose an environment with reduced noise, because it's quite difficult to speak over a room full of other people or to speak over a radio or a television. Try and remain as relaxed as possible and maintain a good posture. It'll help with your breathing. And keep your sentences simple, short and precise. So if you're off and experiencing an off symptom where your speech is affected, make sure that you keep it short and simple. That way you'll be understood more easily, and it won't be as big a chore then to try and repeat what you've said. Make sure you are conscious of making the muscles work. So using your tongue, using your lips and your jaw to work hard to enunciate all sounds in the words, and it'll help enable the speech to be a little bit clearer. And try and over-articulate your speech. So this again will help with the clarity of the speech. If you prolong your vowels and exaggerate the consonants, it will be more clearer. And it's something that we all do, and even doing these Zooms is something that I have to remember to do. And then using your imagination. So if somebody hasn't heard what you said, try and express it in a new way. Or if you feel that your volume of speech is too low, well then just try and imagine that you're speaking to a room of people, and that'll try and project your voice that little bit louder. Some people have severe symptoms with speech, and it's a severe issue for some, and the worse that the more that you try and talk through it, the worse that it'll be. And the more frustrating it'll be. So maybe if it's a severe issue for you, that you always have a pen and paper, so that you can even write down shorthand and just the main bullet words that you need to try and get your expressions and your communication across. And then try and focus. So it's very easy to say that, but if you try and take a few deep breaths and then go again, just try and repeat in another form or another manner as to what you are trying to get across. It's frustrating for you, and then those that are trying to listen to you don't always like to ask you to repeat it. So just try and find ways and stay focused then, rather than being distracted at the same time. That goes for the listener too. So Sialorrhea is excessive saliva, and it is something that is really not spoken about. There was a study in 2020 that they came to the conclusion that obviously it's under-recognized, it's under-treated in many people with Parkinson's. And despite this, it's many patients with the excess saliva in this study described it as one of the most debilitating complaints of their Parkinson's disease. The EPDA carried out a survey in 2021, and they found the same issues, that social embarrassment was the #1 issue that respondents suffered from. About 40% reported that the social embarrassment was their highest ranking issue. Another 20% then stated that the excess saliva impacts on their speech. 15% experienced physical discomfort, and that includes skin breakdown. And then approximately 13% say that there is an impact on their oral care and further symptoms. So excess saliva is caused by poor muscle control, including poor lip seal, poor tongue control, and then the swallow slows down. And this leads to the accumulation of saliva. So like I've said, it's something that a lot of people with Parkinson's do experience, and do find it an embarrassing issue. It leads to speech difficulties, skin breakdown, and then issues with oral care. So it's something that probably isn't brought up with most outpatient appointments. So it's something that maybe you might be aware of and speak with your consultant or your nurse specialist. It may be that you require a referral to a speech and language therapist for non-pharmacological treatments such as exercises. But if it was more severe, there are pharmacological methods that can be used to help treat. And then the opposite, so dry mouth. And dry mouth is something that approximately, according to the EPDA, the European Parkinson's Disease Association, their study found that 56% of people with Parkinson's experience dry mouth. And it's usually caused by medication, but saliva has a huge role, I suppose, for good mouth hygiene and health, but it also helps you to taste your food. So if you suffer from dry mouth, you may have altered taste, more metallic-y taste, which then obviously doesn't make the food as enjoyable. It also lubricates your food to help you swallow. So it may cause swallow issues if you suffer from a severe dry mouth. And it has antibacterial properties and enzymes which help break down the food that you eat and digest. So some issues then, apart from altered taste, skin breakdown. If your mouth is dry, it may lead to cracks, speech difficulties, oral care issues and dental care issues. And then hydration is very important. So some tips then and considerations if you do suffer from dry mouth. One would be sips of water. And I've said this before, and it came from a speech and language therapist, that if we have an issue with either our speech or with dry mouth, that if you have a bottle of water or a glass of water to sip on, it allows obviously the hydration of your mouth, but also allows the hydration of your vocal cords so that they are enabled to glide rather than hit off each other if you're dehydrated. Some people have suggested to chew sugar-free chewing gum, and even small amounts of it. This works quite well because it increases the production of saliva, but it's something to use with caution if you do have issues with your swallow. A lip salve, so dentists actually go back to the old original lip salve of Vaseline, and they find it very effective over all the fancier lip balms and lip salves that you could have on the market. If you're somebody that uses dentures, to make sure that you have denture hygiene and that you remove them at nighttime to give your mouth a break, and then make sure that they're clean with a solution and then with a brush, and try and maintain a healthy and balanced diet. So trying to avoid sugary sweets. Some people suggest supping on sugary lozenges or sweets to increase your saliva production, but actually that has long-term effects then on your teeth. Some tips that you shouldn't do if you have a dry mouth is smoke, as smoking makes the mouth drier and makes the dryness worse. Mouthwashes there are mouthwashes available that help with dry mouth, but they should be prescribed. Some mouthwashes actually contain alcohol, which then in turn increases the dryness of the mouth. As I mentioned, the sugary lozenges, not really the most beneficial long-term solution. And then try and avoid sugary drinks or sugary snacks between meals, because this will increase tooth decay and other oral issues. So then this brings me to oral hygiene. And oral hygiene, as we know, is very important for everybody. Some people are very responsive and responsible and go to their dentist quite frequently, and other people put it off. But oral hygiene is very important, because if you are somebody that suffers with a dry mouth, it can lead to higher rates of tooth decay and gum disease, increasing your risk of tooth decay and then exposing roots, and increasing then the work that has to be done by a dentist, and treatment that is needed then for dental treatment, such as fillings and cavities and all that. People with Parkinson's are seen to have a higher incidence of cavities, be it because of dry mouth or because of motor symptoms or dyskinesia. And it's important to watch what you eat, because obviously, as we all know, that increases the risk of tooth decay. So important to keep your dental routine of brushing twice a day, and the use of mouthwashes if necessary. And one of the important things is a dental visit. So make sure that you do see your dentist routinely. You wouldn't not see your neurologist every year. So it's important to make sure that you take care of your teeth and oral hygiene and visit the dentist as well. Some tips then for oral hygiene and prevention of cavities is to try and establish a regular fixed dental routine. So brushing twice a day, as I said, try and limit your sugary foods and drinks, limit them to meal times if possible, or if not, then try and brush your teeth afterwards. They do say to brush your teeth after every meal, but we don't do that. I'd be very surprised if we all did that. They say also to not brush your teeth or not rinse your mouth after brushing your teeth, because the fluoride contained in your toothpaste actually continues to work and continues to protect your teeth and provide protection. And then to try and avoid eating or drinking for up to 30 minutes after brushing your teeth, again, to allow the fluoride to try and provide protection for your teeth. So the next issue that I'm going to talk about is Swllow, or dysphagia, as some people may have heard of. And this dysphagia is difficulty in swallowing food or liquid. It affects approximately 70% of people with Parkinson's. And it causes a less effective swallow, poor muscle control, again with the oral muscles, and then issues with food and fluids. So not just consistency of food, but fluids can also cause an issue with swallow. The poor muscle control is reduced control or weakness of the muscles of your tongue, your jaws, your lips, your throat, the trachea, the esophagus. So it's all the muscles, I suppose, involved in swallowing food. And some possible signs of an issue with the swallow would be loss of appetite, because that's one of the most common things that I hear, that people are actually afraid to eat, or they have anxiety related to eating or to meal times because they're afraid or conscious of their swallow being affected. Weight loss, then obviously if you have a loss of appetite, it will lead to weight loss. Drooling or excess saliva due to poor lip seal and inadequate posture. The inability to clear food from your mouth, or food sticking to the roof of your mouth. A gurgling with your voice, or unable to clear your throat effectively. Coughing, so this is coughing after either taking a drink of fluids or actually coughing with food. Choking episodes are the more severe potential signs, and it does occur. I've heard of incidents, so it's just something to be aware of. You may have difficulty in swallowing medication, and there's ways and means around that. I mean, some people would take medication in a banana, for example, or take it with a yogurt. Some Parkinson's medications can't be cut in half or crushed. That's something to be aware of and something to ask your pharmacist. Some people may experience pain or discomfort when swallowing. You may also experience heartburn or reflux. And the repeated chest infections may be an indication that there's an issue with your swallow. And this is because instead of the food or fluids going down your esophagus into your stomach, some food or fluid may go down into the lungs, and this would be a cause for possible infections. So just some things to be aware of. So as I said, 70% of people with Parkinson's experience swallow issues. And you just need to be aware of efficient and safe swallowing. There are exercises that can be carried out to strengthen the muscles used for swallowing and make them swallow more timely and more complete, and to make the swallow more efficient. That would be the field of a speech and language therapist for exercises for oral muscle strengthening. The risk of choking, as I said, or the risk of aspiration. So aspiration is when the food goes down into your lungs rather than going down into your esophagus. Consistency and texture of food and fluids. So again, this would be something that a dietitian or a speech and language therapist would be able to recommend, and it would be done after a full assessment of your swallow. But there would be suggestions of particular foods that you avoid, such as dry or crumbly foods. So that sometimes, unfortunately, that includes the biscuits and the cakes. Also, foods that get stuck to the roof of your mouth can be quite difficult then to swallow because you don't have the tongue control to remove it from the roof of the mouth. And that would be the likes of some white bread, or foods that have skins on them, so like tomatoes or hard-boiled eggs, or your cereals. If you take your cereals with milk, they can be quite hard to actually remove from the mouth to swallow then, and they would be the sticky foods. It's also important to assess if there's an increase of mucus. Dairy is usually the cause of this. So if you're somebody that feels that you do have excess mucus, and not excess saliva, this is excess mucus, and you can hear it on your chest sometimes and you can find it hard to clear, maybe reduce your intake of dairy during meal times or that, and it might be beneficial. And I suppose identify areas of difficulty. So if it's with saliva control, for example, poor posture, poor muscle control, if you identify what the issue may be or what may be contributing to the issue of poor swallow, and address it with the exercises that I said, or there are devices that can be given by speech and language therapists to help achieve a good lip seal, and cues then that can also help you to remind to swallow more frequently. And the other thing then is just as important as the environment in which you eat in. So some people may have an issue where they feel under pressure, or they're, as I said, they may be anxious and panicky about when it comes to meal times. So try and have your meal times in a relaxed environment, and for it to be as quiet as possible, which isn't always feasible, especially if you're out and about. But it's just to be aware of the possibility of swallow issues and the importance of addressing it as usual. If it's an acute issue, I would always say contact your GP, or contact A&E if necessary, if it was a choking episode, and never ignore. I mean, choking episodes can be very minor, but it's always something that you should never ignore. And that goes for everybody, not just those with Parkinson's. So the role then of speech and language therapy. So SALT is speech and language therapist, and they play a vital role. Unfortunately, they're few and far between community and private healthcare. It's very hard to actually access the speech and language therapist, especially at the moment. But they provide non-pharmacological treatments and tips and methods regarding breathing techniques, exercises, like I've said, LSVT big, which is something that some of you may be familiar with, which is your Lee Silverman voice treatment, which is an intensive treatment. It's 4 sessions a week for 4 weeks, so over a month, so 16 sessions. And it focuses on amplifying your movements, so making the movements big. Amplitude orientated treatment is proven to be quite effective in the motor function of Parkinson's. Singing is also a very good method of speech and language therapy because it helps you project. So we obviously have our singing with Dara, but it helps you project your voice and provide you with some exercises for your voice. And a few other things that I've come across, teletherapy. So I've spoken about this before, and this is a voice app, voice therapy app, and there are multiple apps out there. The teletherapy is actually an Irish app that has been launched in 2021. I still have to get more feedback on it, but I know there are certain branches around the country that provide the service to their members, either subsidized or that it's actually paid for by the branch. So something that if you did use it and had any feedback about this app itself, you can contact me because I find it very beneficial, just for recommending or not recommending, as the case may be. It is a monitored app, and it is there is a cost associated with it, but they provide you with feedback, and then they can give you reports for your consultant if necessary, and they prompt you, and it's still being developed, so there is a lot more development needed. Some of the feedback I've gathered is that it can be quite repetitive, but that the background programming and the background development is still ongoing. So that's just one thing, but as I said, there are other voice apps out there that help you project your voice. Voice banking is something that I came across recently, and I suppose I came across it really because of Charlie Bird. He was promoting voice banking for his motor neuron disease and the progression of his motor neuron disease. And what it is, it's a message, it's a banking message, or a message banking, should I say, and voice banking. So it's a way to record speech while it's still clear. And then it allows you to have your own voice then when your voice may become more of an issue. But they can be built into electronic communications. So technology, again, coming into play. There are non-verbal methods of speech and language that might be able to be addressed and suggested by a speech and language therapist. And as I said, they also then would help in the area of Swllow, communication and speech. So there is an Irish message banking toolkit provided for speech and language therapists. So if it's something that you might think about, maybe if you have a speech and language therapist, if you're lucky enough to have one, that it's something that you could speak to your speech and language therapist about. It's actually supported by the Motor Neuron Research and the Irish Association of Speech and Language Therapists, but probably something that we'll hear more about over the coming few months, I suppose, with Charlie Bird being such a high profile. And that is it.